Good morning or good afternoon, ladies and gentlemen. My name is Indra Laksono. Today I'm representing my team from Stop TB Partnership Indonesia to present our research regarding the policy in advancing TB agenda in the Village Fund priorities, a qualitative study. As we know, the pandemic situation caused a setback in TB detection and treatment. In 2020, only 43% of the estimated 824,000 TB cases that are notified, and 40% in 2021. At that point of time, there were many discussions on how to recover the Indonesian TB elimination efforts. In order to achieve the 2030 TB elimination target, it is necessary to accelerate the efforts. In short, to achieve the elimination target, the efforts cannot be done like business as usual. So we started to explore what were the possible options for TB acceleration. What were the problems that have rarely been addressed? And eventually we narrowed down to governance issue. Speaking about governance, village government is the closest government entity that has strategic role in development. The 2014 village law gives authority and support for budget allocations, one of which is in the form of village funds, or dana desa in Bahasa. One of several purposes of the rolling out of the village fund is to support village authority in the health sector. In 2021, President Joko Widodo has reaffirmed that the government's commitment to support the elimination of tuberculosis through Presidential Decree No.67 of 2021 concerning the tuberculosis control. This presidential decree is one of the government's policies to respond to the urgency of the TB situation in the midst of regulatory stagnation with a multi-stakeholder and multi-sectoral approach to TB control. The TB presidential decree has specifically provided the direction and the responsibilities of the central government, regional governments, research institutions, private sector, and the community in TB elimination efforts, including the mandate for the Ministry of Village. Through the presidential decree, the Ministry of Village is mandated by the President to formulate policies on the use of village funds that can contribute to the acceleration of TB elimination by 2020. Policy directions for the use of village funds for the reduction of TB cases is one of the important supports in encouraging the role of the village to contribute to the reduction of TB cases in community. Village have strategic roles in promotive and preventive efforts through a list of village-level authorities, such as TB support for TB testing, tracing, and treatment. Second is preparing village regulations and allocating budget through village fund for TB elimination efforts. And third is mobilizing and capacity building for existing health cadres to play an active role in TB elimination together with public health center or puskesmas and other stakeholders in the village area. In October to December 2021, we had conducted research of which the results can be used as the evidence and basis of policy formulation on the utilization of village funds to accelerate TB elimination. The aims of this study are map the policies that support TB elimination efforts in the village, map the role of multi-stakeholders in TB elimination efforts in the village, identify the role of village government in accordance with the village authority in TB elimination efforts. And the last is identification of policy recommendation as an entry point for policy advocacy on the use of village funds to accelerate TB elimination. This study uses an action research approach, where the results are used as a basis to support policy advocacy efforts. The main method used in this study is qualitative, with data collection methods in the form of the study, FGD, and key informant interviews. The main sources of the study or literature review are regulations related to village funds and literatures that discusses the role of multi-stakeholders in supporting the TB elimination through the village fund. Good practices on the role of village governments in TB elimination and policy advocacy strategies that are appropriate to the rural communities' political and social economic context. The FGD involved 50 participants that came from various backgrounds, from national government, provincial government, district government, village government, associations, and civil society organizations. And the key informant interviews involve 24 participants from national government, village government, public health centers, and civil society organizations. As stated before, through the Presidential Decree No.67, 2021, the Ministry of Village is mandated by the President to formulate policies on the use of village funds that can contribute to the acceleration of TB elimination by 2022. But not only that, the decree also targeted that in 2024, 80% of the village allocated their village fund for the TB elimination acceleration, and 80% of the village has received cadres capacity building from the district government. Our second finding is that there are rules regarding village authority that allow the village to play an active role in TB elimination efforts in the village, such as Permendesa, or the Regulation of Minister of Village number 1, 2015, where TB elimination can be mainstreamed into village authorities and affairs, either through existing programs such as RTL, HP, HBS, BMT, community empowerment to support health promotion, or adding new ones such as support for people with TB and their families. The absence of specific points for TB control in the Permendesa or the regulation of the Minister of Village, both annual and multi-year, as stated in the instructions for the use of village fund, requires more concrete policy advocacy assistance. Although the village is seen as having a strategic role in prevention and control of TB cases, the attention of the village is in health activities, especially TB, is very limited. In terms of financing, various studies have shown that in terms of utilizing village funds, which are a strategic source of development financing in village, their use is still dominated by physical development financing. Although village infrastructure is getting better, non-physical aspects of population, such as health development, still need strengthening. So far, the amount of village funds for health has been sought, but in a minimal proportion. This study identified that the allocation of health spending in the village, for example, was more intended for routine needs such as supplementary feeding for children, pregnant women, the elderly, stunting, and the COVID-19 situation has also caused the village fiscal capacity to become increasingly narrow because it is earmarked for BLT, bantuan langsung tunai, or social protection mechanisms in 2022. Persistent issues such as TB are not widely touched, even though the handling of TB requires multi-stakeholder support, including the village. The role of the village in handling TB is increasingly needed, considering the character of TB, which has an impact on the economic, social, and cultural life of the community, including in rural areas. The limited fiscal capacity caused by the COVID-19 is exacerbated by the weak sense of urgency of the village head regarding TB issues. This is related to the unavailability of access to TB patient data for the village heads, which leads to the lack of knowledge of the village government and village communities about TB. The study identified that very few villagers were aware of the TB issue and had the concern to take part in TB elimination efforts. There are still many who think TB is a hereditary disease or even occurs due to mystical factors. Without awareness of the urgency of TB elimination, TB issues do not become a priority in planning, budget allocation, or in program implementation activities in the village. Based on our research findings, we have at least 2 recommendations to advance the TB agenda through policies. First is formulate regulations and guidelines of the Minister of Village concerning TB elimination efforts in accordance with the Presidential Decree No.67 2021, including the use of Village Fund. The second is formulate regulation on priority use of the Village Fund in 2023, which specifically and explicitly provides the possibility for the use of the fund for the TB elimination efforts, especially for a village with high TB burden. It is important to make special arrangements regarding TB so that it can become a legal basis for the regional apparatus in charge of village empowerment to make technical guidelines for the distribution of village funds so that TB issues can be included in the planning and budgeting of the village budget allocation. Thank you very much for having me. I look forward to a fruitful discussion.